Great start.
Good evening, everyone. My name is Danielle Ziegler, and I'm here to speak with you tonight about attention deficit hyperactivity disorder. I not only researched this topic for today and this speech, I have a 9-year-old son who a year ago was diagnosed with this. So I do know the effects on the child and at home and at school, and also how medication can help. Children that suffer from attention deficit hyperactivity disorder, also called ADHD, have many difficulties at school and in their home. These difficulties affect their ability to have a good social life, a home life with their parents, and also with their siblings, and most especially with their peers. ADHD medications are safe, fast, and effective to eliminate the challenges that children face socially, with focus, with concentration, hyperactivity, and with their disruptive behavior at home, and oh boy do I know that one. There are many benefits to taking stimulant ADHD medications. Stimulant medications, Adderall, Dexedrine, Cylert, and Ritalin have worked for 70 to 80% of children with ADHD, according to ADHDnews.com. It improves their focus and their concentration in school, which results in a much, much better report card, and I've seen that too. My son went from C's and D's. Last Friday, I got an honor roll report card, and it's been like that all year, so it's just amazing. Hyperactivity is reduced, and the child becomes less impulsive. Relations with parents and siblings improve. There are also benefits to non-stimulant medications for ADHD. What a non-stimulant medication will do is it boosts norepinephrine, and that's a chemical in your brain that makes you feel happy. That's basically what it's supposed to do. But in hyperactive children or children with ADHD, the hyperactivity is reduced, and according to helpguide.org, Strattera is the only non-stimulant ADHD medication that's been FDA approved, but its ability to help children who suffer from ADHD is incredible, so I think there's probably going to be many more non-stimulant drugs on the market, because that's one of the reasons that parents will choose not to use medication as an intervention for ADHD, because they don't want to put their children on a stimulant. Strattera lasts 24 hours, so what that does is it eliminates the need to give your child medication 2 to 3 times a day. Strattera also has an antidepressant quality, so if your child is suffering from depression or anxiety, as well as the attention deficit disorder, hyperactivity disorder, it will help with that as well. Stimulant ADHD medications, they increase the dopamine chemical in your brain, which also is a chemical that makes you feel good. The dopamine will produce motivation, pleasure, attention, and movement in your child with ADHD, which sounds kind of funny, but it also reduces the hyperactivity and the impulsiveness. So it's sort of, you know, it doesn't sound like you're putting your child on a stimulant, so you think that would increase their activity, but it doesn't. It does the exact opposite in them. Stimulant medications increase concentration and focus while reducing the hyperactivity and impulsiveness, according to helpguide.org. How fast do the ADHD medications work once you decide to put your child on it, and how long do they last? Both the stimulant and the non-stimulant medications work almost right away. So you give your child that medication and you're going to see results like within a day or two, which is wonderful. The long-acting or extended release type medications are available, and that will also reduce your child having to take 2 to 3 times a day, medication 2 to 3 times a day. They typically last from 8 to 12 hours. And with that said, you can obviously see after this, there are many benefits to using the medication as an intervention for ADHD. I've seen it firsthand in my 9-year-old Nathan. It greatly improves kids' quality of life. And if you want to give your child who's suffering from ADHD the best chance at a normal and productive life, I urge you to use these medications as an intervention for ADHD. What I'd like to show you before I end here are some pictures of the brain of children. This right here is walk around so you can see, is the brain of a child who is at rest and on a stimulant drug called Adderall, which also happens to be what my son is on. This picture here, and you can see there's a lot more holes here, I'll come back that way, is a picture of the child who is trying to concentrate. A lot of holes, and this child is not on medication. And then we go to this, no holes. This is a child on the stimulant drug Adderall, and he's concentrating. So you can see a huge, huge